Hi, everybody. My name is Martine Hackett, and I'm an assistant professor in the Master of Public Health program at Hofstra. And welcome to this webinar where I will spend a little time with you talking to you about insurance isn't everything, the surprising things that really influence your health. And so I'm going to start by sort of describing something that we have all been experiencing recently. It seems that health insurance is the biggest concern that many of us have or are talking about when it comes to health. And since the Affordable Care Act was signed into law in 2010, health insurance coverage has expanded to over 20 million Americans. But today, as we debate repeal and replace and protest possible changes, it would seem that having or not having insurance is the biggest impact on our health. And though healthcare is important, what if something that actually is more important to population health is something that you would not expect? What could this be? Your zip code. And one of the things that I will be talking about in this webinar is the idea of how zip codes have a significant way of being able to tell us information about the health of the population, what more so than health insurance. And so the idea that the zip code is something that is an important measure to understanding the health of communities is something that research has been increasingly been identifying. This concept that your zip code is more important than your genetic code is a constant piece of information that we've been seeing in news headlines and in research that people have been doing all around the country. And in fact, despite having the highest per capita health spending, the United States actually lags behind many other countries. And many health indicators are actually are growing. And in addition, growing disparities also remain. And so thinking about this idea that the United States spends more per capita on healthcare, yet has worse health outcomes. And what I just mentioned, that zip codes have an important contribution to the health of populations. Let's take a look and see some of the ways that zip codes actually can tell us about health. So this is a ad campaign that was done in California as part of the California Endowment a few years ago. And here you see a comparison of two zip codes in California that compare life expectancy. So in one, life expectancy is 72, and in the other, the life expectancy for someone born in that zip code is 86. This is another map that also looks at the difference in life expectancy by stops on the metro in DC. And you can see that depending on where you live in along the metro line, that the life expectancy can be dramatically different. In New York City, if we look at New York City as a whole, we can see that a particular measure like blood lead levels can, among children, also can vary very significantly by zip code. And so what we see is that there are neighborhoods in New York City that have dramatically higher rates of childhood elevated blood lead levels than in other neighborhoods. In addition, in New York City, we can also see that infant deaths are also regulated to some zip codes more than others. We see that it's actually a very dramatic difference in terms of neighborhoods that have low infant mortality rates compared to other neighborhoods that have very high infant mortality rates. When we look at a place like Long Island, we can see that these differences in zip codes can even occur among zip codes that are adjacent to each other. So this is an example of childhood asthma emergency room visits, comparing two neighborhoods or two zip codes, Roosevelt and Merrick. And we see that the childhood asthma ER visits for Roosevelt is more than 10 times higher than they are in Merrick. And so why is it that we have these differences, these dramatic differences by zip code in different parts of the country? And so one of the things that's important to realize is that health insurance alone will not address these differences or disparities across race, ethnicity, socioeconomic status, and geography. And in fact, when we look at these health differences, they are in part due to the behaviors that the people who live within these zip codes partake in. So diet, exercise, smoking are absolutely connected to those different health outcomes. But I also want to suggest that where you live, your class status, and how society treats you also plays an important role in the health outcomes of populations. And in fact, increasing awareness of these non-clinical factors, such as education and income, are being seen as having a major impact on health. Researchers are finding that understanding the factors that affect people's health are actually more of the social determinants. So on this chart, for instance, you can see that if we were to break down the things that contribute to health, that clinical care covered by health insurance only covers about 20% of the causes or the contributions to poor health. And even though this clinical care is vitally important to the people who require it, the access and the quality of care, overall that contributes to just 20% of the health outcomes. What we can see is that these social and economic factors like education, employment, income, community safety contribute to 40% of the factors that influence our health, in addition to the physical environment. And health behaviors are accounting for about 30% of those health outcomes. And so when we look at the things that really contribute to these health outcomes, the social and economic factors and the physical environment, it can seem pretty clear why it is that your zip code is connected to the outcome that the population will have for health. And in fact, what we see is this concept is referred to as the social determinants of health. In the United States, we know that there are only a small percentage of health expenditures, less than 9%, are used for preventative health care. And I want to suggest even a smaller percentage are used to be able to address the social determinants of health. And so in this model, you can see that even though our individual lifestyle is something that affects our health, we also know that our individual lifestyle is influenced by our community and the social networks that we have. Our social networks are influenced by our work environment, living conditions, the housing that we have. And those factors are also influenced by larger socioeconomic and cultural conditions. And so this concept of the social determinants of health sort of flips on its head this idea that our health is something that only we are responsible for, or perhaps us and our doctor. The social determinants of health indicate, and again, this is what a lot of the research is sort of telling us about population health, is that in addition to paying attention to our individual lifestyle behaviors and our health insurance and our health access, we also need to be aware of what effect does the environment that we're living in have on our health as well. And so thinking about this concept of social determinants of health, we can think about some of the specific ways that place affects health. When we think about place and health, and again, thinking about our zip codes and how our zip codes are related to our health outcomes, we can imagine that within those zip codes, there are many different factors that also can have an impact on our health. One of the things that don't commonly come to mind is this idea of residential segregation. Residential segregation talks about how are the racial ethnic groups divided across a zip code. And in fact, research will tell us that if we look at the ways that neighborhoods or zip codes are segregated by race ethnicity, that those that have a higher concentration of segregation will also have a higher rate of health disparities. And so residential segregation has been seen as a fundamental cause of health disparities. In addition, within these zip codes, we can look at the built environment. What do the streets and sidewalks look like? How safe are they? What are the other conditions of the environment in terms of parks? Housing hazards. Housing hazards tend to cluster in certain zip codes, and therefore living within those zip codes exposes us to those housing hazards. There are also environmental hazards that can cluster within particular zip codes or areas, fewer options for healthier foods, the safety within a particular neighborhood, as well as what all of these different factors sort of contribute to the individual, which is a sense of stress and chronic stress. And we want to suggest that what all of these different factors look like within a zip code are contributing also to our health outcomes. And so thinking about just living and working and playing within a particular area, particular place, is also going to have an impact on our health. What I'm going to show you now are some pictures from a project that I did with youth that live in some of these zip codes here on Long Island that have these worse health outcomes than some of these adjacent neighborhoods. And what I hope this will do is sort of give you a picture and an understanding of some of the ways that the differences within these zip codes can affect the health of the people who live there. So this is a picture that was taken that represents the lack of healthy food choices and the idea that the people who live within this neighborhood feel that there really aren't many options for them to be able to access fruits and vegetables, for instance. So this is one way that the differences across zip codes is lived on a day-to-day level for the people within them. Another example is this photograph of a site that is actually a brownfield, and it was turned out that this was actually a Superfund site that was about 1,000 feet from an elementary school. And so the fact that the people who live there noticed these sites and knew that they were contaminated, but also saw that nothing was being done about it, and also realizing that there were possible hazards to their health, not only were contributing to the stress that they felt of living there, but also concerns about water and air contamination that may, in fact, have been having an impact on their health outcomes. And finally, the idea that we can imagine that the food access and environmental hazards can have a physical contribution to health are true. But we also have to consider within these zip codes, what are some of the conditions of the buildings and the housing? This photograph shows two different examples of how the closed businesses are having an effect on the people who live there. And so thinking about this idea of creating an unwelcoming environment also plays a role in how people live on a day-to-day basis within these zip codes and how these conditions can contribute to their overall health outcomes. And in fact, research tells us that not only are these zip codes the things that can contribute to the bad health outcomes of the people who live within them, but that the opposite is also true. That if these social factors, these same social factors that contribute to poor health outcomes are equalized, that the health disparities or the differences would also dissipate. And so even though we can see that there's this connection between the social conditions within the neighborhoods or the zip codes that we're looking at, we can also imagine a time when, if these social conditions are equal or equitable to the zip codes that are adjacent or next to them, that we could see a decrease in the health outcomes that occur. And so the idea overall of thinking about zip codes and how they influence health and how this relates to something that we've all are hearing about in the news about health insurance and our access to health insurance. It's not to say that health insurance isn't important or necessary, but it's to say that health insurance is just one part of the story. and that overall assuring healthier living environments for everyone is the rest of the story. So the idea that I would love for you guys to be able to take away from this presentation today is the idea that even though we know on an individual level that it would be hard for us to stay healthy without health insurance, we also need to be aware of the things that surround us every day that also affect our health that we may not even be paying attention to. So that's what I have to say for now, and I thank you for this presentation and allowing me to present to you. So I am happy to be able to answer any questions that anyone can have or has about this presentation today. And like I said, I feel like I just touched the beginning of what this topic is, and there's much more to connect to it. But again, let's think about what any questions that you might have. Okay, here's one question. Are zip codes connected with health outcomes everywhere in the United States? And so what I was able to show is that this is definitely true in terms of different parts of the United States, whether it's in California or DC or New York City. But we also do see this in the South and in other parts of the country. So really what we're looking at is, again, when we think about these differences in health outcomes by zip code, you're going to see this much more starkly and much more clearly where there are these other inequities within the zip code. So places where there are large differences in residential segregation or in housing quality or in crime. You're going to see these kinds of differences as well. And that but however, the cities and the states where there is more equity, you will see fewer of these disparities. Okay, here's another question. How are hospitals addressing the social determinants of health? So this is a great question because this is really addressing this idea of what is the future of being able to address these social determinants of health if, in fact, that research is increasingly finding that the social conditions are contributing to as much as 50%, your social and environmental where you live conditions contribute to up to 50% of your health outcomes. What are hospitals doing about that, right? Hospitals are meant to be able to treat disease as they occur, but what is the solution that they are going to be able to use to address these social determinants of health? And so what we are seeing is that hospitals are indeed increasingly aware, and physicians as well, that these social determinants of health will have not only an influence on whether or not someone gets a disease, but also how well they manage that disease. So I can have a patient come in to my hospital for their diabetes, and I can discharge them, but where am I discharging them to? If I discharge them to their communities, to their home, what kind of environment are they going to be living in? Will they have access to healthier food? Do they feel safe being able to exercise? Are there resources available for them within the community that they're going to live? And so hospitals are becoming more increasingly concerned. And I should also add that health insurance, is also increasingly paying for not just services that hospitals and physicians provide, but also for keeping people healthy. And so if health insurance is going to be reimbursing people to keep people healthy, reimbursing hospitals to keep people healthy, one of the things that hospitals absolutely need to be concerned about are these social determinants of health. And some of the ways that hospitals have been doing this is asking patients about whether or not they have food, if they have healthy food at home, and possibly connecting them with food pantries or even with SNAP, which are nutritional benefits. Other things that hospitals and clinical practices are doing are addressing transportation issues for their patients, in addition to thinking about the jobs and other kinds of referrals that they can give their patients so that their patients can end up being healthier. outside of the hospital. And so I want to suggest that this is absolutely the direction that we see that medicine is going in as we start to realize that these social determinants of health, and in fact your zip code, is something that is important. Okay, let's see, any other questions? Okay, great. So here is a question about, is there a correlation with health insurance coverage by zip code? And does increased coverage, would that be beneficial? So this is a great question. So basically it's this idea that, is it possible that the zip codes where there are these worse health outcomes, are they the places that actually have less insurance coverage as well? And so if one was to, let's say, increase insurance coverage, would that address these the health differences? And so I would say that yes, there is a connection between health insurance coverage and the quality of the neighborhood in terms of the social determinants of health. That places that have the more higher poverty rates and that have lower educational attainment levels, that they are going to also be the people who have lower insurance coverage. However, what we also see is that even if those people were covered by insurance, the idea that they still live within these neighborhoods and that the neighborhoods themselves might be contributing to their poor health outcomes is really the point. In other words, one has health insurance and sees a doctor to be able to be cured or to be treated for a disease. Your neighborhood is what's causing the disease in the first place. And so the neighborhood, I want to suggest, is, and the zip code that you live in can be contributing to the reason why you have to go to the doctor. And then, of course, if you don't have healthcare, then that is going to make the outcome even worse. I think another thing to consider is what's the flip side of this, right? We also know the flip side is true, that in neighborhoods where the opposite is true, that people have higher incomes, where there's higher educational attainment, lower poverty, we also see better health outcomes. And so again, it's this idea that not only is the zip code having a negative effect, but that a better neighborhood gives us a more positive effect. Okay, great. Let's see, other questions. Just one other thing I wanted to mention is that often will hear about, in addition to hearing that zip code is as important as genetic code, which is a very common phrase that we will hear, we'll also hear that sometimes people are thinking about using zip codes as a vital sign. So the same way that when you would come in to clinical care and they take your pulse and they take your temperature and your blood pressure, there is increasing demand to be able to say that we should also take down what your zip code is so that we also have a snapshot of what the health concerns are. Okay, if that's the end of the questions, I really appreciate everybody participating in this webinar. And please see my contact information on the slide, and I am happy to answer any additional questions that you have about the concept of how our zip code can be an important factor that influence our health, even more than health insurance.